Well, my session was on identifying abnormalities of posture, balance, and gait. Those are the basis of mobility, and mobility is an exceedingly important quality of life. For example, the Parkinson's disease quality of life questionnaire has 39 questions. 10 of them are about mobility, about gait and balance. So it's a very important part of everybody's life, whether you have Parkinson's disease or not. Gait is oftentimes assumed to be coming from the cerebellum, the basal ganglia, muscle disease, peripheral nerve with foot drop and so forth. But the higher cortical centers have an important role in gait and balance. And in fact, the best predictor for dementia at this point is a slowing of gait. That gait often goes before cognition is impaired. There are a lot of abnormalities of gait, and I think neurologists often don't look at gait very carefully. They know how to recognize classical things like the classical Parkinson's gait. They know how to recognize cerebellar gaits. They know about a peripheral neuropathy and foot drop, and they know about muscle disease and weakness. But a lot of the gait disorders that you see in just the general population or in Parkinson's population don't fit those classical categories. I think the other thing is examining gait. You can actually start with looking at how somebody sits, how they arise from sitting, how they stand, how they walk. And particularly important is looking at walking when somebody turns, because turning really challenges the system much more than just walking straight ahead. So it's trying to get clinicians to sort of tune in to all these places. You can get clues about gait problems, the propensity to fall. Well, it of course depends on what the gait problem is. So some of it can be specific therapies, but an awful lot of it is physical therapy, and we now really push physical therapy hard. I think a lot more clinicians do, but beyond physical therapy, I think it's also getting people involved in exercise programs that are stressing balance, that are increasing flexibility and working on mobility. Yoga, Pilates, Tai Chi are important ways to do that. There are now gyms often have classes that they call strength and balance, and those are good. And so that goes beyond just the traditional idea of you get on an exercise cycle and you pedal for 20 minutes, or that you pump weights. Now, those strength and cardiovascular fitness are important, but these other things I think are really very important and play a role for somebody whose balance is becoming impaired. Exercise is getting a lot of attention from researchers, and there are now clinical trials on exercise. And I think where we stand at this point is, I think most of those studies would suggest that yes, gait and our exercise is important for balance, posture, and gait. Which exercise, how much you need, how to actually prescribe exercise is not known. And that is something that will be probably worked out over the next 10 years, that how to actually prescribe exercise and perhaps to actually target specific aspects of balance or gait.